I'm Professor Dominique Bremond Gignac from Paris, France. I'm the head of the Department of Ophthalmology at University Hospital Necker Enfants Malades, which is sick children. And I'm also a member of the Executive Bureau of the WSPOS, World Society of Pediatric Ophthalmology and Strabismus. Well, the global prevalence of dry eye, it's a very interesting question, and it's very difficult to define it. But we thought it was probably a rare, and it's much more common that we know. And so it's also an emerging pathology because of the tablets, because of the screens, because of television, and all of this just it's a risk which is much more prevalent. And so the prevalence of the dry eye is really quite common. Instead of that, there is severe dry eyes in children, like Sjögren's syndrome, which is still a rare disease in children. Also, I think really we need more studies to better define it. But what is sure is the dry eye in children is related to meibomian gland dysfunction, and this meibomian gland dysfunction is really a common disease. And also, it's probably an under-recognized pathology because children don't complain. It's not when you just look for the adults complaining, the children don't say anything. They are just rubbing the eye or just, like this. And so it is sometimes very difficult for the parents to understand they have a pathology. And so we have also delay diagnosis and probably underdiagnosed. That's why it is probably an underdiagnosed pathology, but it needs to be treated. Well, the challenge at first, as we discussed, is first to do the diagnosis of the dry eye. And the second point is to do the diagnosis of the etiologies. It means that it is important to first recognize the pathology, but after to understand why this child has a dry eye. And there is multiple causes of it. Probably the more common is the meibomian gland dysfunction with ocular rosacea, and it could be just beginning, so we have simple signs, but after it could be much more severe, and that's why it needs to be recognized for it. And really, after that, when you have made the diagnosis, you have to have a more accurate workup with new imaging and new signs of the dry eye. By the way, one point is really important. In children, you don't have the same examination as adults, so we have to know that. For instance, we have to know that we will not make the diagnosis with a Schirmer test. It's too complicated, too painful for children. So we really know that there is some specific signs, as Professor Nischel just explained, with a break-up time which is much higher than in adults, and that we have to look at it for the diagnosis with a simple test, and this is really very important. We need for that probably new studies because we have very, very few data about dry eye in children. What needs to be done? That's a real very interesting point, because after that, after the diagnosis, we have to treat them. So it could be just regular lubricant, but we know that we have very new technology, new eye drops for it, and it is very important. The second point, as they are children for the treatment, we must consider preservative-free eye drops because they will probably need eye drop for a long period. So we would like to be aware of preservative toxicity, so this is really also an important point. At the time, there are no guidelines, and it will be developed, I hope so, soon, because there is guidelines for adults, and the DWS was 10 years ago developed to send guidelines about dry eye in adults. And at this meeting at WSPOS, we had the first meeting about PDUs to create the guidelines of dry eye in children. So it will open a very interesting discussion to have guidelines for all over the world. Innovation about we span about diagnosis, but the second one is therapies. And so we know that some new eye drops are on the market, like cyclosporine, and also we try to best define the disease which causes and try to have more appropriate eye drops for this. And this is coming by different ways, different mechanisms, and they are really research about dry eye is very nice, because I hope it will pop up very new therapies quickly.